Welcome to ENT student. Now we are going to learn about the auscultation part of the examination of the neck. Auscultation of the neck. A bruit may be heard in an aneurysm or carotid body tumor. Midline swellings of the neck from above onwards. Ludwig's angina. Enlarged submental lymph node, sublingual dermoid and lipoma in the submental region. Thyroglossal cyst lies just below the hyoid bone. Thyroid swellings like goiter, retrosternal goiter are below the hyoid bone. Dermoid cyst may occur anywhere in the middle of the neck. Here are the pictures of Ludwig's angina and midline swellings of the neck. Swellings of the side of the neck. Commonest swellings on the side of the neck are enlargement of deep cervical lymph nodes in submandibular triangle, enlarged submandibular lymph nodes, enlarged submandibular salivary glands, deep or plunging ranula, extension of growth of jaw. In carotid triangle, brachial cyst, carotid body tumor also called as potato tumor, aneurysm of carotid artery. In posterior triangle, enlarged supraclavicular lymph nodes, cystic hygroma, lipoma, pharyngeal pouch, cervical rib. Here the picture of cystic hygroma. Triangles of the neck. Neck is divided into anterior triangle and posterior triangle by sternomastoid muscle. Anterior triangle boundaries are anteriorly by median line of the neck, posteriorly anterior border of sternomastoid muscle, base by the base of the mandible, apex by sternum. Anterior triangle is divided by digastric muscle and superior belly of homohyoid muscle into four triangles: digastric triangle, submental triangle, carotid triangle, muscular triangle. Digastric triangle boundaries are above by lower border of mandible, anteriorly by anterior belly of digastric muscle, posteriorly by posterior belly of digastric muscle. Submental or suprahyoid triangle. Boundaries are medially by midline of the neck, laterally by anterior belly of digastric muscle, base by hyoid bone, apex by symphysis menti. Carotid triangle. Boundaries are posteriorly by anterior border of sternomastoid muscle, anterior-inferiorly by superior belly of omohyoid muscle, superiorly by posterior belly of digastric muscle. Muscular triangle. Boundaries are anteriorly by midline of the neck, superolaterally by superior belly of omohyoid muscle, inferolaterally by lower part of anterior border of sternomastoid muscle. Posterior triangle bounded anteriorly by posterior border of sternomastoid muscle, posteriorly by anterior border of trapezius muscle, base by middle third of the clavicle, apex at the meeting of sternomastoid muscle and trapezius muscle. Multiple primary malignancies. There are two types, synchronous and metachronous. Synchronous, these are diagnosed at the same time or within 6 months of identifying the primary lesion. Metachronous, these malignancies develop after 6 months of identifying the primary lesion. There are structures which doesn't possess lymphatics also, like brain, bone marrow, nerve, cartilage, epithelium, perineurium, membranous labyrinth, eyeball, placenta. Thank you.